more
the
funny
post is
comments.
over there.
Okay.
This one works.
So now it's really on. Thank you very much. So good afternoon, ladies and gentlemen. We are going to have the alien session in this conference because it's about ethics when everybody else speaks about science and regulation and law and technology. We are going to talk about ethics. And the reason is that the people in this room, I think, and on this panel, strongly believe that we need to accompany a new technology from the beginning, or as early as possible, as soon as it seems the technology seems to become relevant for future treatments, development, that we have an ethical debate about the most important issues that are inherent in that type of treatment. And so we cannot simply say it's all the same, it's all medicines, it's all devices, it's all biologics. It's really every technology and every type of treatment have their own ethical aspects that we need to consider. And so what we are going to do now today is also limit this discussion because we have only a limited amount of time, so we cannot cover all the ethical aspects, but we cover that aspect that we find is the most important aspect, or the two most important aspects. Number one, we can only come to solutions if we start talking together, multi-stakeholders, all people coming from their different directions, their different viewpoints, to identify the issues early on, not thinking in silos and at some stage being surprised about all the issues, but really talk together from the beginning. And one stakeholder group, and that we have learned in the last 15, 20 years, is particularly important to get involved very early on, and this is the patient. Now, when trying to pull that session together, I experienced in very concrete terms and conditions that this is extremely difficult because patients and patient organizations mostly say, well, we have not made up our mind yet. We did not have in-depth debate about that. We cannot give you an answer. We don't feel competent about that. So I think that is where we are at the moment. We are technically, obviously, and this shows this conference already quite advanced, but I think the societal and ethical debate about these new treatment options have only started. And so that is certainly part of our considerations that we are going to have to discuss in our topics now here. So what I would like now to do is have first of all, introduce my co-chair, Jytte Lyngvig from DIA. We will manage that together, this session, and then have different representatives from different stakeholder groups making short statements. It's not meant to be lengthy discussions, it's meant to be statements, key points from their angle, and then have a discussion about the involvement of patients, about the multi-stakeholder discussions, and how to get this going and use the time that we have now in front of us and ahead of us to make the most out of it, to manage also the introduction of this technology in a smooth and efficient way and in the best interest of the patients, which we are all going to be or are already now. So with this, I would like to...
I just wanted to say a few remarks because we have actually discussed here in the panel that we would like, and that was why we chased some of you to come here and sit up, that we maybe can turn the so-called Q&A into a real debate. We are not more people and as there are no final answers, we think that in some way all this approach would be very welcome. So we would really encourage you to be entering a debate with all of us after the presentations, if you want. Thank you.
Okay, and then I will also not make long introductions, so Detlef Niese will start. Detlef is, and I know him since many years,